takes as its starting point that really little is known about how COVID-19 has affected the health of workers in precarious employment. Now, when we talk about people in precarious work, we're talking about people working in positions that are typically temporary or casual, poorly paid. And people in precarious work generally lack job security and have limited access to social protection. We were thinking about how those working in essential jobs would be less able to work from home and may be especially vulnerable to COVID-19 due to their proximity to the public and their frequent contact with others. So another worry was that casual workers with informal contracts and limited access to social protection like sick pay may avoid self-isolating if they were symptomatic, because doing so would lead to a loss of important income for their family. So we had three main findings from our work. Workers in precarious employment, many of whom are essential workers, seem to be at greater risk of COVID-19 infection and dying from COVID. Now, the pandemic also seems to be increasing employment and financial insecurity, which is associated with worsening mental health. And finally, the evidence appears to suggest that hazardous working conditions have actually amplified the pandemic. The ultimate lesson that our research provides is that workers whose work has been deemed essential to society during the pandemic, they've risked their own well-being and sometimes their lives for low pay and few employment rights. So fundamentally, what's needed is a society where the contribution of all workers is more fully recognized and where all types of employment are protected by adequate job contracts, employment security, and social protection.